Okay. Okay. Good evening, students. Am I audible? So, Santosh, the topic is we are doing a predictor series for INICET November 2024 exam. I will be telling you the topics which are most likely to be asked in this upcoming exam. So, today we will be discussing few important topics for INICET November. Good evening, Monirudya. So, we will be discussing important topics. Now, we, after analyzing the last 4-5 papers of INICET, I have come down to the conclusion that your most asked topics are LA, few questions from local anesthesia, few questions from exodontia, few questions from trauma, few questions from TMJ, and maybe 1 or 2 image based questions. Alright, so we will see these topics. So the topics I want you all to revise before you go for an exam is local anesthesia, trauma, TMJ, exodontia, 1 or 2 questions. Majorly the questions that have been asked in the past few exams are from local anesthesia, trauma and TMJ. So please revise all of these topics. You can refer the notes. Alright, most of the questions you'll be able to solve from the notes. Okay, so there was a doubt on the WhatsApp group regarding local anesthesia numericals. Good evening, Roshan. First, we will do the numericals for local anesthesia. I think there was some doubt on the group, and it is really not possible to explain the numericals on the group. Alright, so we will first have a look at the numericals of local anesthesia. I'm again going to explain stepwise over here so that it is well understood. Alright, now what is the meaning of 2% lignocaine? What is the meaning of 2% lignocaine? Now, two things you don't need to mug up, you please have to remember. This is a concept you have to remember. Now, there are two things, 2 and a percent. So, percent is always out of 100. A percent is always out of 100. So, this will be 2 grams of lignocaine in 100 ml of solution. Alright, this will be 2 grams of lignocaine in 100 ml of solution. Now we can write this equation the other way around. That means we can write that 100 ml of solution has 2 grams of lignocaine. Okay. Now I will convert the 2 grams into milligrams. I will convert 2 grams into milligrams. So 100 ml of solution will have 2000 milligrams of lignocaine. Okay, and let us see if we have to calculate for 1 ml. If we have to calculate for 1 ml. So 1 ml of solution will have 2000 divided by 100. 2000 divided by 100. Okay. Now, most of the times the question is asked, calculate the amount of lignocaine in one cartridge. Alright, so you have to remember that one cartridge has 1.8 ml of the solution. It has 1.8 ml of the solution. So, now to calculate for 1.8 ml, you will multiply this by 1.8. You will multiply this by 1.8. This entire thing you will multiply by 1.8. Alright. So this makes it 36 milligram of lignocaine in one cartridge. 36 milligram of lignocaine in one cartridge. This you have to remember. One cartridge contains 1.8 ml. Alright. Now, by this method, if they ask you how much lignocaine is present in 5 ml of solution, how much lignocaine is present in 15 ml of solution, you just have to make sure that you are multiplying by the value that is asked you in your exam. Alright? Fine. Now, what is the meaning of 1:2 lakh? What is the meaning of 1:2 lakh adrenaline? Okay. Now, this means 1 gram of adrenaline is present in 2 lakh ml of solution. Okay. Now we can also write this as 2 lakh ml of solution contains 1 gram adrenaline. Okay. Fine. Now we will open up this 2 lakhs. Alright, 2 lakh ml, and here we will convert this 1 gram into milligrams, so that will become 1000 milligram of adrenaline. Alright, now similarly we have to calculate for 1 ml. 1 ml will be 1000 divided by 2 lakhs, alright, which is nothing but your 0.005 milligram of adrenaline is present in 1:2 lakh. Adrenaline contains 0.005 milligrams of adrenaline. Alright, fine. Now again, if they ask you for one cartridge, this will be 1000 divided by 2 lakh into 1.8, which is nothing but 0.009 milligram of adrenaline. Fine. So this is the reason why this is difficult to explain on the group. That is why I took up, the first thing that I took up here is this numerical. Alright, so here we can discuss some very few things only. Okay, so from LA, trauma, TMJ, I am going to discuss some very few things, and the end of the session we are going to do 5-6 MCQs. Okay, so this is the numerical. Alright, now we will come to trauma. See, now in trauma, again, we cannot cover all the things over here. Fine. Few things that I want you to revise in trauma, other things I'll re-explain over here. Triage. Alright. Triage, GCS, intubation. Triage, GCS, intubation. Alright. Fine. Triage, GCS and intubation. I want you to revise thoroughly. Okay. Now I will explain horizontally unfavorable and horizontally favorable here. Again, fine. Fine. Now, what is the doubt from space infection? In notes, you've mentioned infratemporal space as primary maxillary space, but it is caused by secondary infection from submasseteric and lateral pharyngeal space. See, infratemporal space is a primary space, alright, and secondary spaces are your what do you call, your submasseteric and your lateral pharyngeal spaces are your secondary spaces. Alright, the thing is that if you see clinically, according to the classification, these your infratemporal space is classified as a primary space, and yes, your submasseteric space and your what do you call, lateral pharyngeal space are your secondary spaces. Alright, and lateral pharyngeal space is also classified as a deep space infection. This is basically according to the anatomy, and alright, and the thing is, if you see clinically, it is not that the space infection travels from primary to secondary or from secondary to it. The focus of infection can be present anywhere. So what I have told Monirudha is according to the classification. If you go and read the classification, what are the primary spaces and what are the secondary spaces, it is according to that. Alright, that is as per the classification. Fine. And epinephrine dose 1:2 lakh. Yeah. Just see here. Just see here again. You will have to do a little bit of calculations for 1:2 lakh. See, when we say 1:2 lakh adrenaline, it means 1 gram of solution is present in 2 lakh ml of solution. Alright, 1 gram of adrenaline in 2 lakh ml of solution. Alright, you can write this other way around. 2 lakh ml contains 1 gram adrenaline. Here what I have done, I have opened up this 2 lakhs and I have converted 1 gram into milligram. Converted 1 gram into milligram. Fine. Now, for 1 ml, this 1000 will be divided by 2 lakhs. Alright, this 1000 will be divided by 2 lakhs. And 1000 divided by 2 lakhs, I'm zooming out. This is basic mathematics calculation. 1 divided by 200, it comes out to be 0.005 mg. Alright, basic mathematics. And once you have this you can, if you are asked for how much of adrenaline is present in 30 ml, you can multiply by 30 or 15, whatever is asked in your question. Alright, is it clear? I hope the numerical is clear now. Okay, we will go on to, so like I was telling, in trauma, triage, GCS and intubation. Last time there was a image based question from intubation, and we have all seen nice images of our intubation tubes in the class. Alright, so please revise these 3 things specifically in trauma. Rest other things which are likely to be asked, I'll just cover in the next few minutes. Yeah, because that is the dose for anaphylaxis. 1:1000 is administered. That is the therapeutic dose. That has no comparison to your LA. Alright, what you are saying, 1:1000 concentration, that is the recommended dose of epinephrine in an anaphylactic shock. That is different. In that, obviously the concentration of adrenaline will be higher. Okay, and in this 1:2 lakh or 1:1 lakh, what we use in our dental clinics, the concentration is different. Alright. Alright, if there is time, I will explain that Eagleton's criteria. Alright, I want to first cover most likely things based on my, I have prepared today's session based on the trend that I have observed for your INICET in the over the last couple of years, last 5-6 papers. Alright, if there is time, I will explain it to you. Okay, now horizontally unfavorable and horizontally favorable. Just see this. We will first discuss horizontally favorable. Alright, now before going into the details, first we have to understand why is it horizontally favorable, unfavorable, why is it vertically favorable, unfavorable. So the axis in which you view the mandible, in that particular axis you classify this. So if you are viewing the mandible from the lateral aspect, so your eyes are falling at a horizontal axis to the mandible. So if you have a lateral view, radiograph, and you're seeing the mandible from the lateral aspect, that means it is horizontal. Alright, now if you have a occlusal radiograph, and you are viewing the mandible from an occlusal aspect, so your axis of vision or your eyesight is at a vertical angle, or you're viewing the mandible in a vertical axis. Alright, so that is why it becomes vertically favorable or unfavorable. These are the first two things that we need to understand. Now coming to horizontally unfavorable first. Alright. So here the fracture line will be downwards and backwards. Again, we follow the direction of the fracture line from the superior aspect to the inferior aspect. Alright, so it will be downwards and backwards or posteriorly Fine. Now this segment will get displaced because there is no hindrance from this segment. This is segment 1, this is segment 2. Let's understand it like this. Alright, so segment 2 will not stop the displacement of segment 1. Alright, segment 2 will not stop the displacement of segment 1. So what will happen? The segment 1 will get displaced. Alright, so this will get displaced. Alright, now let me simplify this. Let us understand with the help of these two blocks. Alright, so this block here is not causing a hindrance in the displacement of segment 1. So what will happen? Segment 1 is going to get displaced. Segment 1 is going to get displaced. So the direction is superior anterior. Alright, and the muscles responsible, this is the important point, the muscles responsible are masseter and medial pterygoid. Okay, so these are your questions. What is the direction of displacement and which muscles cause displacement? These are your important questions. Okay, now so in a favorable fracture, there will be no displacement of segment 1. Why? I will show you, because this ledge here is going to prevent or act as a hindrance in the path of displacement. जो segment 2 है वो segment 1 को displace नहीं होने देगा. So in spite of being a fracture, that segment will remain in its anatomical position. Alright. So now the thing is, fracture line अगर आप superior aspect से inferior aspect तक देख रहे हो, so the fracture line is running downwards and forwards or downwards and anteriorly. Alright. Downwards and forwards. So ये segment 2 का ये वाला जो ledge है, this ledge which I've shaded in green, this will prevent the displacement of segment 1. I have marked a cross. Arrow के बाद मैंने cross mark किया. That means it is not getting displaced. Okay. Now coming to horizontally unfavorable and favorable. Okay. So I'm drawing the mandible in an occlusal view. Okay, I'm drawing the mandible in an occlusal view. Fine. Now I'll draw the fracture line. I will draw the fracture line. This is segment 1 and this is segment 2. Okay. So yeah, now here we see the fracture line का direction we see from the buccal cortex to the lingual cortex. Buccal cortex से हम fracture line को trace करते हैं towards the lingual cortex. So how is it placed over here? It is placed, it is running forwards or anteriorly. It is running forwards or anteriorly. So this fragment 1 will get displaced. Alright, this will get displaced. Alright, again. So if you want to understand, if we have two blocks like this, 1 and 2, so 2 will not stop 1 from getting displaced. It will not act as a hindrance and this will get displaced. Alright, this will get displaced. Same muscles are involved in the displacement, masseter and medial pterygoid. Direction of the displacement also remains the same. So I'm not repeating or writing it again. And alright, so यहाँ पे fracture line will be this is segment 1, this is segment 2. So we trace the fracture line from the buccal cortex to the lingual cortex. So यहाँ पे direction क्या है fracture line की? It is running backwards or it is running posteriorly. तो क्या हो रहा है यहाँ पे? This bony ledge is going to prevent the displacement. So see, I've marked an arrow. That means segment 1 is not getting displaced. We can simplify this and understand. Segment 2, segment 1. This ledge of bone will prevent the displacement of segment 1. Alright, this segment will prevent. Yes, this is vertically. This is vertically because we are viewing in the occlusal plane. See, Monirudya, you don't need to mug up. Okay. अगर लेटरल व्यू में आप मैंडिबल को देख रहे हो और वो लेटरली अगर ये मैंडिबल है तो आपकी विजन हॉरिजॉन्टल एंगल पे फॉल कर रही है मैंडिबल को. इट बिकम्स हॉरिजॉन्टल. ऑलराइट, नाउ इफ यू टेक अ मैंडिबल इन योर हैंड and see the mandible from the top, so your vision is falling at a vertical axis. Just try to remember, don't try to mug up. Things will automatically become very clear in your exam and you will be able to answer very efficiently. Alright, now coming to the next thing, I want to give you a few points on reconstruction plates. Last time also there was a question and last to last time also there was a question. Reconstruction plates. So, first of all, indications. All right, indications. thin atrophic ridges, comminuted fracture, non-union, or bone loss due to tumor surgery or defect due to tumor surgery. These are your four indications. Okay, these are your four indications, and there are certain rules. That you have to understand for this one. 2-3 points that you have to remember. All right, they are used at lower border. Reconstruction plates are used at lower border. Two things why they are used at lower border. जो reconstruction plates होते हैं वो bicortical screws के साथ use होते हैं. Alright, if you will plate them above the lower border, then the bicortical screws will encounter tooth roots. तो screw tight नहीं होगा. Alright, second thing, when you're using this for the defect, it helps in restoring the contour. It restores the contour of the mandible. Alright, so it is used at the lower border. It is used with bicortical screws. It is used with locking screws. Alright, bicortical screws, locking screws, and minimum of 3 screws on each side. I'll just explain this last point with the help of a diagram. Okay. अगर ये आपकी recon plate है, that means जो आपका bony structure पे rest कर रहा है both ends पे recon plate, you have to fix it minimum with 3 screws. I've drawn 3 holes, so you have to have minimum of 3 screws on each side. Alright, these are certain things that you have to keep in mind for reconstruction plates. You have to keep in mind. And here, one more point I would like to elaborate. Here, this place where it is empty, here also there will be screws, but here what you will do, there is no bone, you will give a good soft tissue cover. आप यहाँ पे लेयर में क्लोजर करोगे. पहले इस साइड बकल साइड वाले मसल को लिंगुअल साइड के मसल के साथ सूचर करोगे, then submucosa, then mucosa. So you will cover the plate completely with a good soft tissue here in this area, in the middle where there is no sound bony structure. Okay, now coming to orbital floor fractures, again 1 or 2 very important points. There have been questions asked past 2-3 times. Again, I have repeatedly told this in my class, in my notes also. Most common wall to fracture is floor. However, the weakest wall is medial. Okay, this is important. Okay, now Oculocardiac reflex or trigeminocardiac reflex is something which is seen with orbital floor fractures. Now what happens? Alright, this is also known as Ashner reflex. Ashner reflex. Now what happens? Here there is a triad. There is a triad of oculocardiac reflex, decreased heart rate, which is nothing but bradycardia, decrease in BP, which is hypovolemia, and nausea, vomiting. Why all these three things happen in oculocardiac reflex? Please don't go into the details of the mechanism, just remember this triad. Okay. Now this reflex, oculocardiac reflex, is precipitated when there is unnecessary pressure on the extraocular muscles. Alright, it can happen as a result of orbital floor fracture, or it can also happen when you are operating, and you are handling the extraocular muscles, then also this reflex can happen. Okay, now please write down: triggered by trapped extraocular muscles. What is given in question bank, Munirudha? I did not understand. In question bank, solution opposite given about fracture walls. Okay, it might be some printing mistake or some error. Do you mean to say that weakest is given as floor and most common to fracture is given as medial? Do you mean to say that? There might be some printing or typing error. But please consider this, that the most common to fracture is floor and the weakest is medial. Alright, this is correct as per standard text. Okay, was that the doubt? And most commonly कौन सा muscle entrapped होता है inferior rectus. Alright, inferior rectus. And this is also known as a trapdoor fracture. ठीक है? Okay. Now, orbital floor fracture can also be associated with something known as a white eye syndrome. White eye syndrome. Now, what is white eye syndrome? There will be no circumorbital ecchymosis or edema. Alright, basically there will be no clinical signs of fracture. So what will happen? I'll give you a clinical scenario. Especially in a pediatric patient, this happens that the parents have got the child to the emergency, and if you see the vitals, the patient will have bradycardia, the patient will have lower BP, parents may give history of nausea or vomiting, or the child would have vomited in front of you. But if you examine the face, if you just by looking at it, you will not see any signs of any injury in the orbital region. So that is a white-eyed syndrome. By looking at the patient, you will say, oh, this is fine, he has no signs. But when you will note down the vitals, you might see a oculocardiac reflex. That is a white eye syndrome. Alright, I think there was a question last time or last time in INICET for this. Alright, so that is what is a white eye syndrome. Now, Again, we will now cover one or two things about TMJ. Again, please revise notes of TMJ nicely and go. Just two things here and then we'll see a few questions. All right. Now, treatment. Treatment of ankylosis. जब भी treatment पूछा जाए, we have to mark the best standard of care. We have to mark the best standard of care. We don't have to see the classification के according treatment क्या है. हाँ, सहानी's classification के according उन्होंने अपने type 1, type 2, type 3 और type 4 में अलग अलग treatment के हिसाब से अलग अलग treatment बताए जा चुके हैं. ठीक है. But when you are asked, if the question mentions specifically what will be the treatment of fibrous ankylosis as per Sahani's classification, you can mark accordingly. But if you are asked about treatment in general, you will always mark in this order, that is interpositional arthroplasty, gap arthroplasty, and condylectomy. All right, and condylectomy. Fine. So the standard of care, कोई सा भी ankylosis हो, if you see in clinical practice, fibrous, juxta-articular, bony, सीवियर बोनी, क्लिनिकल प्रैक्टिस में हमेशा इंटरपोजिशनल आर्थ्रोप्लास्टी करते हैं बिकॉज एंकाइलोसिस का बहुत ज़्यादा टेंडेंसी है रेकर करने का. आई हैव एक्सप्लेन दिस इन द क्लास. ऑलराइट, सो इट विल ऑलवेज बी इंटरपोजिशनल आर्थ्रोप्लास्टी एंड इन इंटरपोजिशनल आर्थ्रोप्लास्टी ऑल्सो द बेस्ट इंटरपोजिशनल मटीरियल इज योर buccal fat pad. Why? Because it has no disadvantages. If you go back to the notes, I have clearly mentioned it has no disadvantages, so this is the best interpositional material, your buccal fat pad. Fine. वो buccal fat pad, it prevents heterotrophic bone formation. Please revise that before your exam. Now, TMJ arthrocentesis. Again, बहुत ज़्यादा डिटेल्स में नहीं. yes भावना, in vitae there will be a radiographic sign of a tear drop appearance or a hanging drop appearance in the maxillary antrum. Okay, this will be the radiographic sign. All right, tear drop or a hanging drop appearance in the maxillary antrum, because the content would the muscle and the orbital fat would have got herniated into the maxillary antrum and got trapped over there. All right, TMJ arthrocentesis, quick points, very quick points, rest given in the notes. So the solution, Ringer's lactate is preferred over normal saline. Minimum amount of solution is 100 ml. Ideal is 300 to 400 ml. तो आइडियल आपको 300 to 400 ml से फ्लश करना है, बट अगर 300-400 ml से नहीं करो तो एटलीस्ट 100 ml से जॉइंट को फ्लश करना है. ऑल राइट, मिनिमम इज 100 ml, आइडियल इज 300 to 400 ml. lavage or wash is always given in the superior joint space. Again, please don't mug up. डिस्क कहाँ होती है? डिस्क और कॉन्डाइल के बीच में we have to give the wash. Disc and glenoid fossa. Disc and glenoid fossa. Disc and glenoid fossa. We have to give the wash in the always given in the superior joint space. Always given in the superior joint space between the disc and the glenoid fossa. Fine. So the reference line is tragocanthal line or canthotragal line, also known as Helsing line. Alright, also known as Holman-Helsing line. Now, what all you can give through TMJ arthrocentesis? Corticosteroids, NSAIDs, opioids, and enzyme preparations. Enzyme preparations में hyaluronidase. Now, what is the function of this? Anti-inflammatory corticosteroids, NSAIDs anti-inflammatory plus analgesics, opioids centrally acting analgesics, enzyme preparations, they remove your adhesions. All of this has been done in the class also. So, alright. Yeah, in fibrous ankylosis, as per Sahni's classification, which is type 1, which is according to Sahni's classification type 1, the treatment is condylectomy, but you actually don't need to, we are no longer doing condylectomy, because it was observed after we were doing condylectomy, there was high recurrence of TMJ ankylosis. So you just need to remember this. As per the current trend, condylectomy is not done. It is always interpositional arthroplasty. Alright, condylectomy is not the standard of care any longer. Okay, so we will quickly see a few questions. Now, sometimes in the past they have asked a few match the following questions, so I've prepared 4-5 questions, which includes a little 1 or 2 questions which have been previously asked and 1 or 2 questions which I have prepared on my own. So now match the below mentioned sign. Should I zoom out more? Match the below mentioned signs to their associated fractures. Alright. See, essay questions में the tip is, if you know all the 4 on both the columns, well and good. If you don't know 1 or 2, at least don't panic. First try to match the maximum that you know. Okay, so and then look at the options. ऐसे नहीं करना ऑप्शंस में क्या परम्यूटेशन कॉम्बिनेशन दिया देन हम जाके उसको मैच कर रहे हैं अपने दोनों कॉलम्स से. No, you will end up making a mistake. First you see column 1, you see column 2, and you then try to match as many as you know. First, जो 1-2 नहीं मैच हो पा रहे हैं या in case you do not know, just first match the maximum that you know, then look at your options, because if you go vice versa, option देखोगे पहले फिर match करोगे तो high chances of committing mistakes and errors. ठीक है, so this is the first thing that I want to tell you. Or if they specifically mention Sahanis, then on yes, if they specifically mention Sahanis, then the answer would be condylectomy for type 1 Bhavna, because condylectomy बिल्कुल obsolete treatment हो चुका है. अब हम लोग नहीं कर रहे हैं, हम interpositional arthroplasty ही करते हैं चाहे कैसे भी टाइप का एंकाइलोसिस हो, क्योंकि interpositional arthroplasty से क्या हो रहा है, हम recurrence को काफ़ी हद तक डिक्रीज कर रहे हैं. तो when I was teaching you TMJ ankylosis, during the treatment I had told the aim is to decrease the chance of recurrence. That is why interpositional arthroplasty is the standard of care nowadays. Now, let's see. अब कॉलम 1 में पहला ऑप्शन क्या है, डिप्लोपिया. For diplopia, you see what is diplopia and see the second column कि second column में diplopia सबसे ज़्यादा best fit कहाँ आएगा. So diplopia, will it be seen in Leaford 3? No. Will it be seen in orbital floor? Yes. In ZMC? No. And in mandibular condylar fractures? No. So diplopia is B. Okay. Now subconjunctival hemorrhage. Alright. So it won't be seen in Leaford 3. Orbital floor fracture is already taken. Yes, it will be seen in ZMC fracture. Okay. The next option is battle sign. Battle sign we all know is classical of a mandibular condyle fracture. So it will be in a mandibular condylar fracture. And एक ही बचा है antimongoloid slant, and yes, it is actually seen in Leaford 3. Alright. Now you go and see your options. जो आपने sequence बनाया है उसको कौन सा option match कर रहा है. So 1 with B, 2 with C, 3 with D and 4 with A is your option B. This is your answer. Alright. This is your answer. Fine. Now it says match the local anesthetic agent to their characteristic features. Again, column 1, column 2 wala question hai. Like I told you, see column 1, see try to match the maximum and then you go ahead. Alright. So bupivacaine. दूसरे कॉलम में क्या दिया, वेसोकंस्ट्रिक्टर, पोस्ट ऑपरेटिव पेन रिलीफ, नेचुरली अकरिंग एलए एंड मिड हेमोग्लोबिनीमिया. ब्यूपिवाकेन एक लॉन्ग एक्टिंग एलए है तो वो पोस्ट ऑपरेटिव पेन रिलीफ के लिए यूज किया जाता है. सो ऑप्शन बी गोस विद ब्यूपिवाकेन. ऑलराइट. नाउ pyrilocaine, we all know it is associated with methemoglobinemia. So this is D. Again, cocaine, we know that it is a naturally occurring local anesthetic agent. So with cocaine, we will have from the corresponding column option C. And ropivacaine causes vasoconstriction. So A. Now when you have a sequence 1 with B, 2 with D, 3 with C and 4 with A, you find that particular option amongst your given options. Alright. So again, option B is the one that is the correct answer. Okay. Now, in mass casualty cases, the mechanism to sort out patients is done in what sequence? State the sequence below. तो इन्होंने ब्लैक, ग्रीन, रेड, येलो दिया है एंड आपको से करेक्ट सीक्वेंस में अरेंज करना है. ऑलराइट, यू हैव टू अरेंज इट इन द करेक्ट सीक्वेंस. सो सबसे पहले रेड, फिर येलो, फिर ग्रीन और फिर ब्लैक. मैंने बोला था ट्रैफिक लाइट के सीक्वेंस में याद रखना red, yellow, green and black. Alright, so this is your sequence and option D is the correct answer. Alright, please जाके नोट्स में रिवाइज कर लेना. वी आर शॉर्ट ऑफ टाइम. रेड में क्या आता है ट्राइजिंग कैटेगरी में, येलो में कौन से पेशेंट्स आते हैं, ग्रीन में कौन से आते हैं और ब्लैक में कौन से आते हैं. रेड को फर्स्ट प्रेफरेंस होता है, येलो को नेक्स्ट, ग्रीन को नेक्स्ट एंड लीस्ट प्रेफरेंस इज टू ब्लैक. ओके, प्लीज गो एंड रिवाइज. Now the next question. After performing gap arthroplasty for TMJ ankylosis, which of the procedures will help in functional rehabilitation of the patient? Yes, RYGB. Okay. Which of the following will help in functional rehabilitation of the patient? Now we will see. Fat grafting क्या करेगा? It will prevent reankylosis or it will prevent heterotrophic bone formation. ठीक है? Alright. So physiotherapy will help in return to function. Temporalis fascia lining, again it is a glenoid fossa lining material. It will act as an interpositional material. It will also help in preventing ankylosis. And placing a suction drain. तो सर्जरी के बाद हम लोग क्या करते हैं, एक सक्शन ड्रेन लगा देते हैं टू इवैक्यूएट द ब्लड क्लॉट्स, एक्सेस सीरोसैंगुइनस फ्लूइड और the clots. Alright, so that is the work of a suction drain. So functional rehabilitation will be taken care by physiotherapy, aggressive mouth opening exercises, early return to function. Alright, they will help in functional rehabilitation of the patient. So the answer is option B, that is your physiotherapy. Now, injection of local anesthetic agent into which of these areas will cause facial nerve palsy? Okay. Pterygomandibular space, submandibular gland, parotid gland or buccinator. Now, we will not go into the others. We will just see few facts. The fact is that जो फेशियल नर्व ट्रंक होती है वो पैरोटिड ग्लैंड को सुपरफिशियल लोब और डीप लोब में डिवाइड करती है. ऑलराइट, सो फेशियल नर्व ट्रंक के ऊपर जो पैरोटिड का लोब होता है वो सुपरफिशियल लोब होता है, जो उसके नीचे का लोब होता है वो डीप लोब होता है. ऑलराइट, सो इफ बाय मिस्टेक यू enter the parotid gland, so it is going to cause facial nerve palsy. But please remember that this facial nerve palsy is transient in nature. It is transient in nature, that means it is not permanent. And also you have the 5 terminal branches of the facial nerve exiting from the parotid gland. Alright, so that is why if you by mistake inject LA into the parotid gland, it will result in facial nerve palsy, and this facial nerve palsy, please remember, is transient in nature. Alright. Okay. This is an important question. Which rib is most preferred for harvesting costochondral graft? Five, 6 and 7th rib. I mentioned in my notes also. 5 and 6 for males, 6 and 7 for females, to hide scar in infra mammary crease. ठीक है. Now, a very important point that I want to tell is अगर 5, 6, 7th rib सारे ऑप्शंस में दिए हुए हैं, what will you mark? 5, 6, 7th rib सारे ऑप्शंस में दिए हुए हैं consecutively. ऑप्शन ए है 5, ऑप्शन बी है 6, ऑप्शन सी है 7th और ऑप्शन डी है 10th. Now what you will mark? You will please mark 6th rib, because 6th rib is common to males and females. Alright, so that is the best choice that you can mark. Okay, अगर तीनों options में 5, 6 और 7, तो please go with the 6th rib. Alright, fine. Now with this we are ending our session, but I want to give you a few tips how to solve your MCQs in the exams. I repeatedly say this in the class also. सबसे पहले, I'm not talking just about oral surgery, I'm talking about the entire paper. In the first of all, you don't have to panic, you have to be calm. First go, just try to solve as many as questions that you're able to solve easily. Alright, एक बारी पूरे पेपर का रन थ्रू करो. जो नहीं आ रहा है उसे छोड़ दो. Just leave that further. You can maybe in the second round come and spend more time. Okay, this is your first tip. Second is, please read your question carefully. क्या करते हैं, हड़बड़ी में क्वेश्चंस पढ़ा, आधा नहीं पढ़ा, ऑप्शन देखे, ये होगा, ये भी होगा. No, just if you want, you are not able to resist, just with your hand, just cover the options on the screen. Read your माइंड में रजिस्टर करो कीवर्ड्स, उसको बनाओ, एंड देन यू गो टू द ऑप्शंस. दिस इज माय सेकंड टिप. माय थर्ड टिप, image based question. You see the image and the question first. You see the image and the question first. अगर कोई हिस्ट्री दी है उसको नोट डाउन करो, उसके की पॉइंट्स उठाओ. ऑलराइट, उसके क्वेश्चन उठाओ एंड उसको पहले पढ़ो. यहाँ पे कोई कौन बनेगा करोड़पति देखता है. ऑलराइट, इफ यू सी कौन बनेगा करोड़पति, आजकल केबीसी में भी इमेज बेस्ड क्वेश्चन पूछने लग गए हैं. ऑलराइट, सो व्हेन यू सी कौन बनेगा करोड़पति, in that when Amitabh Bachchan sir is asking an image based question, he just puts the question on the screen and he shows the image. Alright, once the candidate has seen the image, then he will give the options. Alright, so in an image based question, you have to understand the image, pick information from the image, pick information from the question, and then go to your options. Alright, so these are my 2-3 points for you to do better in your exams. Alright, fine. So please keep these tips in mind, and I'm sure you all will do well. You all have worked hard. Alright, you have the notes of all the subjects with you. You just need to revise and you need to recollect your notes in the exam, and you will be able to answer all the questions. Okay, Monirudya, cavernous sinus thrombosis. Yes, that is true. So don't worry, by late night today I will upload a small note regarding cavernous sinus thrombosis on the WhatsApp group. Alright, just give me a few hours time. I will upload regarding Eagleton's criteria also, regarding cavernous sinus thrombosis, and what are the nerves involved, and how cavernous sinus thrombosis, what is the etiopathogenesis. Alright, just give me a few hours. I will upload a small handwritten note in the WhatsApp group so that you all can answer. So I think we should wind up our session because you all have another session also. So I wish you all the very best. Sleep well on the night before the exam. Go through your admit card, what is allowed at the center, what is not allowed at the center. Take a good night's sleep. Try not to revise in the last few moments before standing outside the center before you get entry. Try to be calm. Exam में सब याद आ जाएगा. Try to revise. Try to maintain your calm composure and give your best. And just don't be in a hurry. Don't make silly mistakes while you are in a hurry. Take some time to spend some time with your question, and I'm sure you all will be able to do well. Alright, so with that we will end our session. All the best, dear students. And cavernous sinus thrombosis, I will upload a few important points in the WhatsApp group later in the night today. Alright. Thank you so much, students. All the best.